In tonight's Health Alert, many children break a bone during childhood, and while wearing a cast has been the long-standing treatment for such injuries, new research found that splints are just as effective as casts in treating wrist fractures in young patients. More on those findings tonight from ABC's Dr. Timothy Johnson.
Remember when kids would get hurt on the playground and they'd come in the next day wearing a big white cast that the whole class would sign? Well, that could soon be a thing of the past. In a new study by Canadian researchers, splints were found to be just as effective as casts in treating wrist fractures. They were also more comfortable, easier to clean, and caused less anxiety for the kids. The study involved 92 children who had recently fractured their wrists. About half were assigned to wear a splint and the other half wore an arm cast. After 6 weeks, a physical therapist found that both devices were equally effective in healing the injury. Overall, parents and children were also more satisfied with the splint. Of the children in the casts, 68% of them said they'd rather have worn a splint. Only 12% of the splint patients said they would have preferred wearing a cast. But some doctors do worry about a frustrated child who can take a splint off at any time. With this Medical Minute, I'm Dr. Timothy Johnson.